Hi, my name is Robbie Omondi. Welcome to Life 360. Now, Life 360 is all about your health, which is our business. And today we want to speak about obesity. I was talking to Dr. Taruna, who will be giving us detailed information about obesity and the various procedures that are available in the market, and not only in the market, here at Third Park Hospital, where if you come here, you'll get to discuss with the doctor about your weight loss issues, or rather your weight issues, and you'll be able to get solutions to that. Now, allow me to introduce Dr. Taruna, and she will take us through what procedures are available and what risk you stand when you don't take care of your health. Welcome.
Thank you, Ruby.
You were telling me about obesity, and there are several solutions to obesity. Maybe just take us through briefly, what are some of the solutions to obesity that are available?
If I talk about obesity, lifestyle modification is the biggest solution. But it becomes a challenge when it is very difficult because of busy life we could not reach to the required changes or the process to be followed. So looking after all these challenges, we have come up with the procedures which is called bariatric procedures. We do both the kind of procedures like surgical and non-surgical. So if anybody, any obese person who is failing to lose their weight with proper lifestyle modification, following many healthcare industry products, following exercises and everything, still they are having a challenge of losing a weight, then you are most welcome over here. We do a procedure which are laparoscopic surgical procedure. They are not open surgeries, they are minimal invasive procedure. It's hardly 25-30 minutes of a procedure which gives them more permanent solution for their weight. They come down to their normal weights within a duration of 6 months to 8 months or a year period, right? We do all kind of bariatric procedures, like we do mini gastric bypass, gastric bypass, sleeve gastrectomy. All these procedures are surgical. We also do non-surgical procedures like balloon procedures. We do allurion gastric swallow-pill procedure. We also do endoscopic scarless procedure, where you don't want any scars on the body. You can do endoscopic procedure. We also do single incision procedures, where it's a kind of a cosmetic where you don't find a single scar on your body. So we do all these things. In simple language, if I brief about what we do in this process is, we reduce the capacity of your stomach size. We reduce, if needed, we also reduce the length of your intestine if needed by a surgical means. When I talk about non-surgical, we just fill the capacity, we occupy the volume of your stomach by filling it with the balloon. So all these procedure in short give you early satiety, feeling of fullness, no craving towards the food. You have very good lifestyle modification. You go with good weight loss, and because of this weight loss, your confidence increases, your physical endurance increases, your confidence increases. So in short, this procedures helps you in losing with the excess weight.
Yeah. Now, most people right now, I've heard about the balloon procedure, but when people hear about surgery, the only thing that comes to mind is them being cut open and staying in hospital for a long time. But you're saying these are procedures that take a very short time, and one is free to go and actually now eventually go through weight loss to get their desired weight. How is this possible?
Yes, this is possible, because I know earlier the surgical procedures were done, there were big wounds, there were big stitches, sutures on the body. I know they are reading all those things right now also, but would like to tell all the obese patients who are reading all these things, they should come up and talk to the expert, talk to us. Now, with going time, the technology has really advanced. So the procedures nowadays which are done in bariatric are minimal invasive. In short, you can say they are done with a very, very less scars, and the recovery time of the procedure is 24 to 48 hours. So now if you talk about this procedure, they are really very easy to go. They are done under minimal anesthesia. They don't have any side effects. And in fact, when I talk about Dr. Mohit is the surgeon who takes very minimal time in doing the procedure.
Weight loss, or rather obesity, is not just how someone looks or feels. It could be a leading factor to many other diseases. What would you tell a patient now, maybe who just feels like it's just weight and I'm okay, but they're actually putting themselves at risk of many other diseases, including infertility in women?
Yes, definitely. It's a very good question, and I would really want to address that anybody who is suffering through this disorder called obesity, don't take it lightly, because this is really a mother to many diseases. Till the time you can bear the weight, till the time you can go through easily with the excess weight, it's okay. But it doesn't mean that you're okay. It means you are challenging your body's stamina, your health, that at what extent it can bear the weight. When you challenge your health with this, it means you are waiting for the day when it will get deteriorated. So carrying or bearing obesity for a longer period of time is not going to affect you internally, externally, all the way, but it is going to affect you psychologically also. And I would suggest the people who are suffering through this, they should really treat obesity, because obesity has many impacts. When you talk about infertility, yes, in young generation, it is the most common impact. Many of the youngsters, they feel they are failing to conceive due to uncertain reason, but they don't focus on their obesity part. I would like to tell them, just treat their obesity, they will have a healthy pregnancy. If you are not obese, you have your healthy marital life, you have your healthy sexual life, you have your healthy conceiving, you have your healthy pregnancies and deliveries. Because weight affects entire body. It affects your uterus, it affects the childbearing capacity of a mother, it affects everything. So along with infertility, there are so many comorbidities like diabetes, type 2 diabetes, particularly cholesterol, uric acid, UC, back joint, knee pain problems. All these are associated directly with obesity. You reduce your weight, automatically you can go after 3 months and check your vitals. You will come to know it was not disease. It was because of obesity, those things were there. And they get cured. So cure them on the time. If you don't cure it on time, definitely it will reach to an extent where it will affect your organs, like excessive cholesterol, excessive long-term standing blood pressure. It will affect your heart, your uric acids, your high fat levels of the body. It will affect your kidneys, it will affect your liver, it will affect your external bone capacities. So you should cure it on time. You're really going to face a problem if you take it as simple.
Now, for my viewers who would like to come for consultation or to see a doctor to understand how to go about obesity or weight matters, how much would you advise for them to have, or rather would you want them to come? And please also share where they can find you, so that in case one wants to come here, they know where to get you.
I'm 24/7 available in Nairobi. I'm sitting in Third Park Hospital, so they can come and meet us. We have our personal numbers, hospitals numbers, which we will share with you. You can share with them. And secondly, I would only give a message to people. Come and consult. Consultation is not taking anything. We are not charging for consultation. I would like to tell you, Ruby, we have consultation free of cost. Because what Dr. Mohit feels is, to consult means to educate, and education is a right of every person. Just because you don't want to spend on the consultation charges, you are taking yourself or pulling yourself back with the education. So my suggestion will be, I am available here 24/7. Call me, come to Third Park Hospital, consult me, have discussion on the topic, share your problems with us, because we have sure short solution for your problems. So they are most welcome. They can come, they can consult us. I would really love to educate them.
Thank you very much. And for me, it's the first time to hear a hospital that has free consultation.
Yes.
Most of the places, there is always consultation. Now, that is a catch. And definitely welcome all to Third Park Hospital. And when you come, say Ruby referred you. You'll get the best services, and I'll definitely be happy when we're all healthy, living a good life. Thank you very much to my viewers, and allow me to end it here. Until next time, this is Life 360. Bye-bye.